We want to welcome you to our speaker series in observance of Black History Month, and our focus is on mental health. And tonight, our digital educational events are sponsored by West, Merck, Daiichi Sankyo, and additional support from Lilly and GSK. We're so proud to have them as sponsors. And Erin just went over a little bit of the housekeeping, but we are going to ask to keep yourself muted, please. And then we're going to start with the presentations. And as you mentioned, there will be time at the end for questions, and at the end of each topic. And then at the very end, we'll ask for more questions. And you can raise your hand or come off mute or put the questions in the chat should you have any. I will be monitoring that. And then this is recorded, and you can always view this recording on our Her library. So we're excited to have that too. As a reminder, on February 29th at 1 p.m., we are going to have the Ask the Experts. And this is wrapping up our February with relationship and sexual health Q&A. And it's going to be with one of our amazing providers, Sabitha Palau Freeman, and she will be answering the questions that she hears most often about relationships, dating, intimacy, and so much more. So be sure to go and submit your questions, and don't worry, if you want them to be, they will be anonymous. It will be streamed on Facebook Live, so no need to registration, and you could submit all your questions to uniteforher.com /herlibrary/ask. Okay.
And I will say, Melissa, we've already got some great questions from our community. I was checking already, so lots of interest and inquiries already.
I'm sure we do, because this is always such a great topic. And Sabitha is fantastic, so you don't want to miss her for sure.
Yeah.
Wonderful. And then I have one more announcement I want to just share with everyone. So we are so pleased to announce that Touch, the Black Breast Cancer Alliance, is the winner of our 2024 Community Partnership Award in our clinical trial space. And we are honored to share their information with you. And we have a little resource for you. So Erin is going to pop in the chat a flyer about their information. And if you would like to be involved in what they have going on, please contact the link that Erin is putting in there, uzo@touchbbca.org. And thank you so much. Touch is such a great organization, and they've been a great partner for us. So we're looking forward to this.
Yeah, they do wonderful work.
They do. They really do. Now, tonight, as we observe Black History Month, we're focusing on mental health in our Black community, and we're so excited. And we will start tonight with a presentation to lay the groundwork on therapy in the community, including perceived stigmas, how to overcome obstacles when addressing or discussing mental health, and why it's so important to health overall. We will be highlighting two specific types of therapies, both in which we may break down so that you know how it's compared to traditional therapy, but can be incredibly impactful and supportive. So starting with our first presenter for tonight, I'm sure you've seen her before because she's done some series for us before, but we have Cassandra Bolding. And Cassandra is a licensed professional counselor, substance abuse professional, HIV specialist, nature-based therapist, and a PhD candidate. She is a global thought leader on implementing community-based approaches and destigmatizing mental illness in the BIPOC community, enhancing gender equality in programming, and promoting trauma for informed care. Please welcome me in joining Cassandra Bolding.
Hi, good evening, everyone. Good evening, good evening, good evening. Welcome, welcome, welcome. I'm so excited. I am so grateful that Unite for Her is taking this opportunity to acknowledge Black History Month, but I think more importantly, to talk about such an important subject, which is mental health in the Black community. And so my section, I'm going to talk a lot about stigma, but not just about stigma, understanding like historical context of the stigma. So my section is called, I'm setting my timer because this is a big topic in 15 minutes. I'm going to get it all in. Okay, so my talk is going to be breaking the silence and addressing mental health stigma in the Black community. And so in order to understand this subject, we're going to talk a little bit about stigma. So when we're talking about stigma, we're referring to negative attitudes and beliefs about mental illness. And in the Black community, mental health stigma is often prevalent and can prevent individuals from seeking help. And so we're exploring this in order to understand the causal and historical factors so that when we're talking about provision of care, we're understanding how we can make care more culturally relevant to ensure that we are able to destigmatize mental illness and accessing mental health treatment. And so let's dive in. So when we talk about stigma, understanding stigma, we're talking about when we say stigma, we're talking about it involving like stereotypes, prejudice, discrimination against individuals with mental health conditions. And so we understand that stigma perpetuates shame, fear, and silence surrounding mental illness. And stigma can be both external from society and internal, so self-stigma. So there's an internalization of, the stigma that many people experience within the community. And so just understanding like there are historical factors. So including systemic racism and discrimination contribute to mental health stigma in the Black community. So there are certain cultural beliefs and attitudes in ways that they may view mental illness as a sign of weakness or spiritual deficiency. So there's also a fear of judgment and distrust of the mental health services and which are common barriers to seeking help. And so when we talk about historical context, there's like a fundamental mistrust for the medical community, for the psychological community. As we know, there is a history of experimentation on Black and Brown bodies. And so therefore, there's a fundamental mistrust for these two communities. And so when we talk about the impact of stigma, stigma can lead to delayed treatment, exacerbation of symptoms, and decreased quality of life. Many individuals suffer in silence rather than seeking support due to their fear of stigma. And so when we talk about stigma and a person being stigmatized, and we talk about discrimination, it's very isolating. And within our community, the Black community, Brown community, we are a collectivist societal structure. So, we are very communal. And so we, thrive within community. And when one experiences mental illness because of the stigma that's associated with mental illness within the BIPOC community, it can be very isolating and it can be very challenging for families. It can be very challenging for, partnerships and relationships. It can be very challenging in many different arenas when you think about the stigmatization of those who are mentally ill or the stigma that's associated with accessing mental health treatment. And so when we talk about the challenges of stigma, it's like education and awareness campaigns, can debunk the myths and misconceptions about mental illness, encouraging open dialogue and destigmatizing conversations about mental health within families and communities, promoting culturally competent mental health services that address the unique needs of the BIPOC community. And I think like that's such an important one. And I think the three of us, myself, Diane, and Jummy, being a part of this dialogue, I think is very important because representation does matter. Being able to have therapists that represent the population that they are servicing matters. It helps to, ensure that we are able to create a more ready rapport and that there is a level of safety that individuals feel when they are working with someone that is representative of the population that they are from. And not just representative in terms of being a part of or a member of that particular population, but I think representative as well in the strategies and the techniques that are utilized, as well as how they are being utilized within the therapeutic sessions. So I think that that's such an important point, and I had to emphasize that really quickly. And so when we talk about like supporting mental health, so empowering individuals to seek help and access mental health resources without fear of judgment. So creating a safe environment to do that. What we're doing tonight, I think is a big part of that, is being able to create that conversation, having that dialogue about mental health, about accessing mental health treatment, the relevance of it, the importance of it, what happens when it's not sought, the implications of it, how it impacts the community, the medical system, et cetera. and being able to cultivate a supportive and understanding environment for those struggling with mental health challenges. So one of the things that myself, and I know that Jumi does this as well within our community, and I know Diane does this as well. Diane does a lot of work within the community to bridge the gap, to ensure that there are spaces that are created and different types of spaces. So within my practice, I provide groups, I provide community organized community events that center on having a conversation around mental health, around grief, and around other subjects that unfortunately sometimes we avoid talking about. And I gave a talk previously where, and this is the next section where it talks about breaking the silence. And so it's, by challenging stigma and fostering a culture of acceptance and support, we can promote mental wellness and healing. And together we can move to create a more inclusive and compassionate society where everyone feels empowered to prioritize their mental health. And silence is such a big thing in our community. And we had talked about this in a previous talk that I had given, that silence was a means of survival. So, in order to keep your family safe, you had to stay silent. In order to keep your family safe, you couldn't talk about the things that you were experiencing. And then when you think about the systems of oppression, uh, and it is something that I really wish I had more time to unpack. When we think about systems of oppression and ways that people are marginalized, having one more thing, that one more thing that you have to add to the things that you're already being discriminated against, or the stigmas that are associated with it, that one more thing, some people don't want to disclose that. So there's a lot of silence and secrets that are kept around it, because of that reason. Because for many people, it is, another way of othering them, another way of discriminating against them. And so when you think about all the intersecting factors like the gender bias, racism, and then you think about the stigmatization of those who are mentally ill, then you can, understand, like, in terms of that silence, why many people are silent. And in my work, I've done work abroad in many different countries like India and in Ethiopia. And one of the things that I found that was so interesting in Ethiopia, that the stigma that's associated with mental illness there has a lot to do with religion. And so for many people, there is a belief that, mental illness, unfortunately, is a punishment from God. And so there's a lot of shame because there is a large Orthodox Christian community there, and it is very devout. And so for many people, that is seen as, a punishment from God. So there's a lot of shame around, mental illness. And this is not unlike many other countries where, because there's not a lot understood about the nature of it, and there's a westernized perspective in terms of its explanation. For many people, it is, seen as, something to be ashamed of. For people like parents who have children who suffer from mental illness, is something to be ashamed of or to feel guilty about. So it's very interesting, like, when you understand, like, these different causal and sustaining factors for mental health and mental illness stigma, and the stigma that's associated with accessing mental health. Um, and then now let's talk a little bit about what resources are available. And Jumi and Diane are going to talk about some of the actual modalities and treatments, but in terms of resources, so there is the National Alliance on Mental Illness. There is Therapy for Black Girls, Therapy for Black Men, the Steve Fund. There is Black Emotional and Mental Health Collective. There's the African American Health Providers. And those are just to name a few. And I'm sure that Diane and Jumi will talk about their own individual practices as well. And there are many practices. There are more practices, I think, at the advent of 2020, with everything that was occurring. I think there were more practices that kind of sprang up during that time, within the BIPOC community. And there is an awakening to the benefits and the importance of addressing mental health issues within the BIPOC community. And so understanding mental health stigma in the Black community is a significant, mental health stigma in the Black community is a significant barrier to wellness and recovery. And so one of the things that I think is very important is raising awareness, challenging the stigma, and fostering supportive environments. And by doing so, we can promote mental health equity and empower individuals to seek help. And so working together helps to break the silence and prioritize mental health in the Black community. And so this conversation that we're having, I know I had to kind of rush through and run through a lot of the information, but I'm sure Unite for Her is very responsive. And so when you ask for it, they provide it. So if it's something that, any of you would like to explore further, I will definitely provide my information by way of Unite for Her. My information is on the website as well. And I wanted to really explore this subject matter because I think when we're talking about mental health within the Black community, that we cannot talk about it without talking about the stigma that's associated with accessing it. And, and we also talk about access. Access is another point to talk about when we're talking about the stigma, because there's not a lot, there's more access, but there's not a lot of access to these resources. And sometimes the access to the resources are, preclude certain people because of their socioeconomic circumstance. And so there are just so many different factors, like when we're talking about the stigma. So it's not something that is not generated by a causal factor or historical context. And then there are all these other compounding factors, like I said, like access, like being able to have access to these services. So I am so grateful that I had the opportunity, and I feel I have like 3 minutes left. So I'm so glad that I had the opportunity to kind of just talk a little bit about this subject, because I think it's an important one. And the more that myself and other clinicians within the BIPOC community continue to have these conversations and continue to educate people about the benefits of accessing mental health treatment, and also understanding that a lot of the health conditions that we experience within our community, a lot of the health conditions in specific. And one of the things that in my research that I was, I had uncovered, and it was startling for me, that within, especially like when we think about Black women, although like many of us look younger, younger than our chronological age, that because of the oxidative stress and the stressors that we experience on a daily basis, and not accessing mental health resources to be able to address those things in ways that are culturally relevant, for many of them, they are 10 years older than their counterparts as a result of the amount of stress. So that's just an example of, and this is their internal organs are 10 years older. So they're aged 10 years older than their chronological age because of the stressors that they're experiencing that they're not able to address. So I think like these are all just vital points in terms of understanding the importance of accessing mental health treatment, as well as understanding the importance of increasing access to treatment that is culturally relevant. And within my practice, I have a holistic health center. And within my practice, I incorporate various different types of modalities that are specific to different cultural contexts that create a safe environment for people to access these services without the shame or the guilt that sometimes is associated with accessing the services. And so we have different modalities, like we use sound therapy, we use Reiki, we use other types of somatic healing processes, we use nature-based therapies. So there are many different ways that we incorporate, and we do a lot of work collectively as well, which I know that for many people within the BIPOC community, they thrive in these social types of settings where it's more collective or more cooperative, where people are working together, and intergenerational. I've also found that has been very helpful in terms of working within the BIPOC community and ensuring that these different factors are in place and these different resources are in place has been very successful in terms of ensuring that not only people are accessing the treatment, but they are also maintaining consistency with the treatment as well. And so with that, I just wanted to say again, I'm grateful to Unite for Her. I'm grateful to all of you who are here, who are listening, who are attentive. And hopefully you will take this information that you're learning tonight from myself and the other two presenters and share it and talk and have these conversations, and not just this month, but this month and beyond. Thank you.
Oh, Cassandra, that was so good. And, again, we know that tonight is going to be packed with information, and you were just briefly skimming the surface of this because it's such a big topic, right, that we have going on. And, especially what you said about, breaking the silence, that was the first thing that just perked my ears, breaking the silence. That is definitely something that we have to do. And then when you talk about, like you said, many of us, we are complimentary, we receive compliments all the time saying, oh, you look so young, you look so good, and things like that. But, exactly what you said, what we carry on the inside is sometimes a lot different than we carry on the outside. And those are the things that we need to talk about. And you and Jummy and Diane being able to provide this space and the resources for us to talk about that is so wonderful. And we thank you guys for doing that. And Cassandra, I'm going to ask if you can put like some of those resources that you just rattled off, if you could put that in the chat for us too, because that would be great too. And Jummy and Diane, when you get up to your plate too, if you could do that, because, we're always looking for additional resources to share with our community so that they know where to go, so they don't have to be silent and they don't have to do this alone. And, that we can destigmatize mental health in our community. So I just thank you for starting this off, because it's wonderful. And again, just the beginning, just the start off. So thank you so very much, Cassandra. And hang on, because I'm sure we're going to have some questions and comments. So, we want to make sure that we're getting to those as well. Okay. Thank you so much. That was wonderful. So we are going to now introduce Jummy Kirby. So Jummy is the visionary founder of Relinquish and Transcend Counseling. And Jummy's passion for holistic well-being is evident through her practice, where each therapist specializes in their own unique niche to provide personalized support. She's licensed in New Jersey, in Delaware, and Pennsylvania, and she is dedicated to serving our diverse communities. So again, Jummy, thank you for being here, and we welcome you.
Absolutely. Thank you for having me. I am just deeply honored to be in a room with such impactful women. So thank you so much. I'm about to share my screen. All right. So I'm here to talk to you guys about ecotherapy. I don't have to go into who I am because, Melissa, thank you. You just did a fantastic job. So I'll just dive right into it. Ecotherapy is pretty much a form of therapy where you're able to spend time in nature, focusing on your mental health, your physical health, as well as your emotional health. And I love ecotherapy because it looks different each and every time. And what I mean by that is, with each person, whatever you feel like doing, whatever you feel like talking about, that's what we will focus on during our ecotherapy sessions. So briefly, what ecotherapy looks like, it pretty much could be you sitting on a park bench on a log in the grass with your therapist, pretty much having talk therapy. You could engage in nature hikes. It could be meditative, where you have a silent meditation, just internally going through what you're feeling, what the area looks like, and just really dissecting that moment. And it could also look like having walks and talks with your therapist, just traditional walk and talk therapy. And then it could be gardening, just focusing on the different stages of life. And it could also look like sitting by a stream of water, just using life as an analogy for the most part. And I, with a colleague of mine, we did an ecotherapy group, and we have to bring it back because we had such great feedback. So I have to talk to him about it. But to the left, the picture on the left, we pretty much did art therapy out in nature, just focusing on what you see and really just pertaining it to your life and how you're feeling in that moment. In the middle picture, we were doing a silent meditative hike where we just focused on how we were feeling in that moment, what situations are arising for us, any concerns that we're going through. In the top right corner, we did a hike where we were using nature as metaphors and different analogies. And then at the bottom right, I gave them a journal prompt and they were able to reflect and write down what they were feeling, what came up for them. And then at the end, they were able to share. So the benefits. Ecotherapy has a lot of benefits. So there's stress reduction, there's improved mental, physical, and emotional well-being. Your confidence and your self-esteem is able to be boosted, it's able to improve. You're able to really connect and ground yourself in nature. Some of your ADHD symptoms, they become reduced. You feel a greater sense of purpose, and you're able to cope with grief and loss differently. I have a participant in one of my groups. She was able to disclose to us that she does suffer from ADHD. And she was saying that mindfulness and like meditating is very, very hard for her because a lot of thoughts and feelings just like swarm her when she's in the room. But she was like, for some reason, when I was outside in nature, I just felt different. And I was able to silence my mind and really focus on what I wanted to feel in that moment and ground myself. It was because she was able to focus on the nature sounds, like the birds chirping or the rustling of the leaves or like certain smells while she's trying to silence her mind. So some of the things that ecotherapy is able to treat is anxiety, depression, stress-related conditions, PTSD, like I said earlier, ADHD, grief and loss, low self-esteem, some mood disorders, addiction, substance abuse, burnout. It just improves your overall well-being. And then it could also complement cancer treatment as well. So for you guys, I wanted to do a grounding activity, if you guys don't mind. So I want you guys to just be comfortable in your seat, if you can. You guys are in a quiet spot, of course. I want you to just relax your body as you're in your seat and just close your eyes for a moment. Gently close them. And what I want you to do is just focus on your breath. I want you to take a few deep breaths to just relax yourself. I want you to inhale through your nose, allowing your lungs to fill up with air. And then I want you to exhale through your mouth. And I would like you to do that for a moment. Now I would like you to, and still keep your eyes closed, just picture a serene, natural setting that is in your mind. It could be a peaceful forest, a flowing river, a tranquil beach. In your mind, I want you to imagine the sights, the sounds, the scents that's associated with this place. And I will guide you through your senses. With sight, I want you to visualize the colors, the shapes, and the details of your chosen natural setting. With sound, I want you to imagine the soothing sounds. It could be the rustling of the leaves, the flowing of the water, or a simple bird song. With smell, I want you to envision the natural scents, the earthy aroma of the soil, the freshness of the air, or the sweet scent of the flowers. With touch, mentally feel the texture of the ground. Feel the warmth of the sunlight or the cool breeze that's against your skin. And I want you to just take a moment to just sit in that for a couple seconds. Now with your breath, I want you to breathe a little bit deeply. As you continue to breathe deeply, I want you to allow yourself to just immerse into the mental nature escape and feel a sense of connection in these elements. Now in your head, I want you to just take a moment to express gratitude for the beauty of nature. And as you return to the present, whenever you're ready, I want you to just take one more deep inhale and exhale. Slowly open your eyes. Move your shoulders around. Relax yourself. I thank you. I thank you for just allowing me to just be in your space for a moment. And here is my contact information. If you have any questions, concerns, I am here. So thank you again.
That was wonderful. That was so good. Oh, that was good. That was relaxing and feel re-energized there. And I just want to say, like last year, I had the pleasure of being at the collective with Cassandra and Jummy, and who I feel you were referencing, Kevin, as well. And we went on a nature walk, and that was my first time. And to be honest, I didn't know what to expect, but so many times we hear people say, be in the moment, be present. And sometimes that's really, really hard to do. And we try to do it. But when you are in nature, and even this guided meditation that you just did right now, it is so different. And it is so welcomed. It just does your body good. And when you say mind, body, and spirit, it does it for everything, mind, body, and spirit. So I challenge you, who are with us tonight, if you've never been on a nature walk, and it's great to do a guided one like this and to be with one of our practitioners and do it, but even if you just have to go outside and just like look around and observe what's around you. So someone, I won't say who, but I heard someone say there's no bad weather, you just have to have the appropriate clothing to do this, right? So sometimes we think, oh, it's raining, I can't do that. No, that's not bad weather, you just
Put
have
a
to have the
poncho on,
appropriate
get
clothing.
an umbrella.
Exactly. So, that's my little challenge for you all tonight, to think about, ecotherapy as a different way of therapy. Challenge that traditional type of therapy, because there's so much more. There's so much. And Julie, that was wonderful. Thank you for bringing this to our attention, and thank you for sharing your information. And again, for those of you, we're all here with Unite for Her tonight, and these are some of our providers that we have. So we are so blessed and fortunate to have them with us. So thank you for being here, and you hang on too, because I'm sure there's going to be some questions.
Absolutely. Thank you.
You're welcome. Oh, this is wonderful. Oh my gosh, so good. And last but certainly not least, we have a special guest. Her name is Diane DesPlantes. And I hope I did it justice with saying that. So Diane has been a psychotherapist for more than 35 years, specializing in trauma. She is a licensed clinical social worker in the state of New Jersey and a member of the National Association of Social Workers, and has a certification in clinical social work supervision. As a member of EMDR, she served 5 years on the executive board, and she is a certified therapist in EMDR, and this is what we're going to learn about tonight, and an improved EMDRIA consultant. And she's also a approved trainer. So thank you, Diane, for being here. It is our pleasure to welcome you to our Unite for Her community. I think you're still muted, Diane.
Thank you so much for the invitation. I really get excited when I get the opportunity to kind of be with my people. And so I'm very happy to be here with you guys today. Thank you for inviting me. I first want to just tell you a little bit about me and then about EMDR. I became a member of, we call it ENDRIA, and about 15 years ago. And when I got into this organization, I had an experience and I realized how effective EMDR therapy was. So I decided to become a member of ENDRIA. When I got to the first conference, it was kind of shocking, but also normal that I was what one of my friends say, the drop of chocolate in the glass of milk. And I thought, this is not good. We have so many of our people who have been oppressed and abused and even murdered. And here's a therapy that is not out there for our people. And it's truly one of the most effective therapy that I've ever done. So I made it my mission to increase the number of EMDR clinicians of color. That was something that no one even thought about or decided that they could do. So I broke that glass ceiling and I went up the ladder to become a trainer. So I literally am the first person who created training of BIPOC clinicians only. So I only train clinicians of color because we do not have enough clinicians out here that can work with our community, that understand some of the struggles that we have gone through. And when you are healed, you see the world differently. When you're going through all of the stress, body and soul, you are dealing with darkness. But when you get an opportunity to get healed, the whole outlook of how you see the world, the strength that you get is something that I think we need. So I created a space that wasn't there before. A lot of people are not aware of what EMDR is, never heard of it. So I'm going to give you the shortest version I can with the PowerPoints. So give me a second while I tune into this. So I am part of what they call the Advanced Education Institute. I am certified to train clinicians. In our training, there's a requirement. You have to be there for 6 days. There are consultations that we do. There's readings that have to be done, and you have to participate in every of the activities that we have. EMDR therapy started with a woman named Francine Shapiro. Francine Shapiro was the one who created EMDR therapy. She walked through the park one day. She had something on her mind. She was a little concerned. She didn't know what to do, but she noticed something that was very different. When her eyes moved back and forth, somehow the feelings that she had was being reduced. She went to some friends and asked them if they ever noticed something like that, and they said no. Francine was an amazing individual. She passed away about 2 years ago. But she said there was something there, so she pursued it. And in her pursuit, she created a study, and she focused mostly on veterans and those who have been sexually abused. In this study, she asked these individuals to bring up things that were disturbing, and she utilized her finger to have them move back and forth so they could follow. That has activated a part of the brain. And I'll talk a little bit more about that. Before, in our communities, we had thought that post-traumatic stress could never be healed. But with utilizing EMDR therapy, it was healed. But the other communities and the other modalities did not accept that. So she put a pilot project together. And if you know how hard it is to get your studies, being put, she did her study and it was accepted by the Journal of Traumatic Stress. People started to realize that EMDR actually did what others could not do. So we deal with trauma. As we put those studies together, the community started to realize that this was something that was extremely effective. So the American Psychiatric Association practice guideline, they include EMDR. The International Society for Traumatic Stress also includes EMDR. The American Psychological Association has approved EMDR as treating civilian trauma. The UK National Institute of Clinical Excellence now requires clinics that they provide for post-traumatic service, and also they use CBT and EMDR. And the World Health Organization has included EMDR therapy, and they recommend it for children, adults, and adolescents. People always think that EMDR is just the eye movement, but in reality, there are 8 phases, and each of those phases, utilizing them, is what a full EMDR session is. So we first start off with getting history. However, because I work specifically with the Black community, the BIPOC community, we created questions that you will never hear in other therapies. So questions like this: have you ever been misjudged, misunderstood, held back, harmed, or physically assaulted because of any aspect of your identity, race, or culture? Questions like, have any of your immediate or extended family experienced misjudgment or discrimination because of their identity, race, or culture? If so, what actions were taken? What happened? Who did you need to be there for you? Has this been spoken in your family? These are questions that we ask when we do history taking. They're not yes or no answers. They give us a story about these experiences, but no one's ever asked them these questions. So we specifically ask questions like this. In phase 2, we prepare the client. We help them understand what EMDR is. We help them understand the different parts of it. We like our patients to be very educated, and we want them to be part of, because EMDR is client-centered. The client is the one who actually runs this program. An assessment in phase 3 is what we call the setup. EMDR does not need a lot of verbiage. We literally need the client to tell us, in that particular incident that we are talking about, what was the worst part. Once we get the worst part, then we ask them, what is the negative belief that they're carrying with them now? Then we ask them, what would they like or prefer to believe about themselves now? We have a scale, because people say, well, how do you know this is working? We have 2 scales that we use. For the positive cognition, a scale is from 1 through 7, where 1 is completely false. They don't believe that positive sense of self. And 7 says they have totally embraced that positive sense of self. In phase 4 is called the desensitization phase. And in that phase is when we desensitize that traumatic event that they've experienced. And here's where we use our second scale. We ask the client, how impactful is this traumatic experience for you? How disturbing do you feel when you think about this particular incident? There's a scale from 0 to 10. A client, if 0 means that they don't have any difficulty thinking about that situation, a 10 is the highest level of disturbance you can imagine. So let's say a client says they're a 7. As we utilize what we call bilateral stimulation, which is the eye movement, we desensitize the difficulty that they have, the disturbance. Our goal is to get it to a 0, so the client will say, I don't even, when I think about it, it doesn't bother me anymore. The difference between our therapy and others is that we deal with the brain, because someone can say, don't worry about that, you're going to be fine, but they still may not believe it. But internally, if they use their own brain to work on the issues, it's internalized. So they believe it, they accept it because it comes from them. Once we desensitize the traumatic event, then we instill a positive sense of self. So maybe at first they may believe about themselves, I'm not worthy. And they walk around the world every day having this feeling because of the trauma that they've experienced, that they feel they're not worthy. The positive cognition says, I'm a good person, I am worthy. And we instill that. So we take away that negative belief that they've been holding on to, and we instill that positive sense of self. We also understand that trauma affects the body. So we have to make sure that we clear that body of any trauma that it may be holding. And we have a way in which to do that. Once we take care of the body and we clear it, then we close it down. In EMDR, we always come back to reevaluate how the client feels about what we have cleared. And it's always amazing when a client who's come in and has a trauma that they feel could never be released. Once they go through all of these phases, they do remember the trauma, but it doesn't affect them the way it did before. They don't have that negative belief any longer about themselves. They now have that positive sense of self, right? We close it down by helping the client see that they're going to experience, because once we open up the brain then continues to be activated. And throughout that week, their brain is still working. When they come back to us, we then scale it to find out where they're at. So for me, it's so important to go back to say, now that you've had this experience, that trauma that you've been holding on to, the trauma does not exist now. How do you feel? The client is amazed that that trauma that they've been holding on to for years, they can't get it back. They don't feel it anymore. It doesn't affect them anymore. So we reevaluate each time a client comes back and things that we've worked on. The process that we've used is called the adaptive information processing. All right, this is an internal process that happens automatically. It's kind of like your breathing. It's automatic, right? So when something happens that's disturbing, it gets locked in a part of your brain. Now, normally, let's say you go to a movie and you get scared, all right? But you come out and you think, I'm fine. You know, it was just the movie. But when there's a real trauma, that trauma gets stuck and it never gets reprocessed out. Utilizing EMDR, we can actually open up that trauma and connect it to a more healthier way of thinking about themselves, right? So the memory is stored in a part of your brain, but what happens is that trauma contributes to the pathology and the health of an individual. Trauma causes a disruption of your normal adaptive processing, and then unprocessed information is dysfunctionally held in the memory. So when you think about the DSM-5, all right, usually that deals with neglect or abuse, okay, or an undermining your self-worth or your safety. We deal directly with the traumatic event, and your brain is actually doing the work, all right, and it takes that disturbance that you have been walking around with, and it clears it out. And we do that by something what we call bilateral stimulation. We stimulate the brain to process the traumatic event, right? So these memory networks contains the perception, the affect, the sensation of the disturbing event, and then they're stored in such a way that it isn't allowed what our natural processing does, which is the adaptive information processing. So there may be similar experiences that occur and linked into that unprocessed memory network, and the negative affect and sensation is arise. So the clinical implication of what we call the AIP model is that the observation of EMDR treatment effects suggests that pathologies are represented by the dysfunctional information that is physiologically stored and that we can access and transform directly without using medication. Okay, we use your own brain to heal you. So rather than targeting some reaction to something that's disturbing, such as biofeedback or flooding or relaxation exercises, EMDR focuses on the traumatic memory itself. That's what we work on. The way in which we do it is called the touch tone event. So the memories are composed of stored information, images, thoughts, and sensation. And they get stuck in a part of their brain. We then look at how we can activate by using bilateral stimulations. There are many different what we call bilateral stimulations. One of it is eye movement. Another one is what we call the butterfly hug. Okay, so we can use different methods to stimulate the brain to work with whatever the traumatic event is. So we link it to this information is encoded, the experience of the earliest trauma that they've experienced. The trauma is linked to what we consider the presenting problem. So we deal with it by allowing the client to float back to when they first felt that type of disturbance. We're not working with what they present. We're working with where it was first laid down in the brain. We use what we call the 3-prong protocol. So the goal of the treatment is to process the dysfunctional memory and incorporate a new adaptive memory. We use the past memories to set up what we call the foundation. All right. The present is what situation may have triggered the situation that happened in the past. And the future is to help the client connect to all the positive things that they get out. Right? We have to find out, is the client ready for this? Just because you're experiencing trauma doesn't mean that you're actually ready to process it. So we do a scaling to see how much you disassociate, because it's very important to find out how a client disassociates. We want to make sure that there's no major psychosis. We want to deal with what we call the organic base of loss of consciousness. All right. We want to make sure that a client is not actively in danger. We want to make sure that the client has the ability to what we call state change, which is if you're experiencing something discomforting, you have a means of able to move that out and bring in something more positive so that you can now work with it. But if there's something that is constantly disturbing in your memory, then we can't work with it. Our brain has to be calm in order for us to activate what we need. So we have to make sure that the client has the ability to what we call tell the truth, exactly what it is that you're feeling or what you're experiencing. We want to make sure that the client doesn't take certain medications because those medications can slow down the brain processing. Okay. So EMDR is one of the most effective therapies I've ever used. I think it's effective because it's not someone outside of you telling you that you feel better or things are better. It's your own brain working out the disturbance that you are experiencing. That's why it sticks. I'm trying to do the short and crazy as fast as I could, so you get a sense of it. But I can't wait for questions because that way I can explain or give you more insight to it. Okay, thank you.
Yeah, Diane, that was wow. Things that I certainly didn't know about, and I'm sure others didn't either. But I love, congratulations to you, first of all, for, being the first to be able to train clinicians of color, and that is amazing. So congratulations to you. That is wonderful. And thank to all of our panelists for, doing what you do for our communities, right? It's so warm and so welcoming for that. So thank you to all of you. But Diane, how do you see this? I'm going to start off with a question for you. Like, how does it work? I know it can work for anyone, but specifically for, our community of cancer patients, how do you see this in action working for them?
Okay, so you think that a cancer patient has a lot of fears, all right? So the question becomes, where do these fears come from? Where did that fear start? So sometimes when you ask that question, they cannot like give you an answer. Once we ask them to float back, okay, and it's amazing what our brain is able to do. They can float back to a time when they were 5 years old and they were taken to a hospital, all right, and they were terrified because they didn't understand what was going on. All they know is they were being moved, but that fear, no one ever really tapped into it. But that fear carried on for the rest of their lives because no one ever thought that it was important enough to find out what that fear was and how that fear impacted how they interact with the world around them.
Interesting. Wow. This is so much. And again, with little time, it's so much information here that has been shared tonight. And I'm going to bring Cassandra and I'm going to bring Jummy back on the screen too. This way we can open up for anyone who has some questions or anything in the, that they want to put in the chat. And I'm just looking now. Tiffany says, thank you for this. I never heard of EMDR, and I've worked in the mental health substance abuse for area for over 20 years.
Yeah,
This,
I think
yeah.
that's one of the reasons why I'm training clinicians of color. This is a therapy that has been out there for years. The reason we haven't heard of it is because it has been dominated by the white community, and the prices that they charge are $200 a session, $300 a session. So I have created an environment for clinicians. First of all, I lower all of my prices for the trainings. All right, that's the first thing we do. And then we start to help them see how they can work within their communities and utilize this therapy to start healing people. We have very specific questions that we ask of them so that they will start to understand that this is something for them. Like, I don't belong because I am, right? I come from, I'm not good enough. I'm invisible because I am. I have no voice. Think about those questions. Those are things that we experience, okay? And those are things that no one even asked them about. But those are the traumas that we hold within ourselves.
That is so true. I'm just looking. Mary says, thank you to everyone who was there. This information is so great and necessary. And you're absolutely right, Mary. Are there any questions that we can have for our panelists? We do have a few minutes. So I'd love to hear, feel free to come off mute if you'd like to and just ask a question openly. And I believe I'm correct in saying that, Jummy, both you and Cassandra have been trained under Diane, correct? So isn't it nice for the teacher to see her students here this evening?
Yes, it is.
Yes, that's beautiful.
That's awesome. I
Yes.
do have a question. So the clinicians that you teach, Diane, are they like licensed therapists?
You have to be a licensed therapist or you have
Okay.
to be a student. We train students and that are in college because we want to introduce that to them quickly. But you
Okay.
should have a license, be a licensed therapist in order to do this particular therapy.
Okay, because my cousin's a licensed therapist, and I'm definitely going to talk to her tonight about this.
I put my phone number in there, all right, so that
Yes.
you can call me.
Okay.
I'm training right now. I've got about 15 students in my class. I have trained over 100 clinicians of color.
Mm, wow.
Amazing. Yeah,
That's amazing.
that deserves applause for sure. That's
Yes, it
amazing.
does.
Yes.
And I just have it's pretty much a statement. I just appreciate all of you ladies being here because being someone who's worked in mental health and substance abuse for such a long time, and I actually have quite a few therapists, licensed therapists in my family. And it's just good to see because my cousin worked full time for quite some time as a licensed therapist, and then she started her own business. And even in her own practice, she gets where she has to refer people out. And so it's good to know that there are a lot more, people of color that are therapists. So I just appreciate that I'm learning that, there are a lot more out there than we actually think, and that I can pass along your information to others who may need your help. So this was very valuable tonight.
Well, thank you, Tiffany. We appreciate that. Absolutely.
Yes.
And and Mary says, thanks Unite for her for this segment. Of course. Cassandra alluded to this earlier. We want to make sure that we are bringing the topics and the subjects and the content to our communities, and we need to hear from you. So if there is something that you want to learn more about, like, again, maybe you didn't know about EMDR before tonight, maybe you never heard of ecotherapy before tonight, and we all hear about mental health, but maybe you weren't sure about how to go about really internalizing that for yourself. So this is why we're bringing on this very professional and capable and talented panel of women in our community that are able to provide these resources to you, and we're so proud to be able to do that. Really, it's been remarkable. Aaron and I were already chatting in the background about, like, okay, what else can we do? How can we like extend this and go on and on with this? Because it's just touching the surface with this information that we were been able to share tonight. And Diane, I heard you say at the beginning, like, you were taking so much information out, but even the information that you gave was so impactful. Just to know, like, those questions, the few questions that you started to read about, getting the history, so impactful. Yes. Just amazing. Um, maybe we should bring them back each to have an hour. Thank you, Tiffany. We will take all of this feedback into consideration for sure. We definitely will do that. Yes.
It would
And
be my pleasure to come back and really give you and help you and show you how effective this therapy is, especially for people of color. And
yes.
I work with the Native American communities, I work with the Asian communities, okay, with the Latino communities, with the African American communities, because those are the ones who are really struggling on this earth.
Absolutely. So appreciate that. Yes. And I know, Diane, you put your information there, and Juby, I know that you had it on a slide, and Cassandra as well. But if you can just make sure that you're dropping your information in the chat again so that our members can have all of this. And of course, you can always reach out to Unite for Her and we can share that information as well. But while we have everyone tonight, that's perfect. Okay, I'm just going through and I don't see anything more, but I just want to open up for a last call of any questions or comments. And again, you don't have to put it in the chat. You can just drop it in, either come off mute and just say whatever you want to say. But we do appreciate this tonight, and we are going to look for another forum to share this information again, so that we can have a little bit longer time with this too the next time. I say thank you so much. Hopefully I can find someone near me who can provide these therapies. Yes, and I hope so too. And we can help you hopefully with that. Felicia, you just let us know where you are when you say near me, and maybe we can help with that. Because and I believe, Diane, do you do virtual sessions and in-person sessions?
I do both. Virtually, I literally, Chicago, Illinois, California, so they come virtually, which is great. I'm also right now doing working with Seton Hall here in New Jersey. and I'm training their clinicians now. I've gone to Virginia in person and trained them over there. So yeah.
Perfect. Yeah, and again, so I know Jummy and Cassandra are also, you know, licensed in other states. Felicia said she's in Texas, so we can certainly, you know, share some information there too. So that's wonderful. That is really great. Okay, and I'm just looking to make sure I'm covering everything. Thank you, Jimmy, for putting your information in there. Cassandra, thank you so much. Wonderful. Well, I thank you all for being here tonight and taking the time. This is recorded, so it is going to live on her library if you want to go back and get more information. But like I said, just reach out. We're happy to share this information with everybody. I see something else popping in. Oh, that's Cassandra's phone number. Perfect. Thank you, Cassandra, for that. So just take advantage of the resources that have been shared with you tonight. Great information. And if you ever need any more information, please reach out to us, excuse me. It is our pleasure to share. Thank you again to Diane and Cassandra and Jummy. It has been a pleasure to get to know you more and to get to know, you know, the services that you provide. Maybe these services can be included in the wellness program, just as a thought. Well, it is indirectly. So an EMDR is part of the counseling. So like Cassandra and Jummy being with us as counselors, they're able to use EMDR. So that is a part of the passport, but maybe we need to make that more explicit. Like when we have our provider, as you know, we're building a provider website so that all of this information could be shared. So we will try to call that out a little bit more there. So thank you so much for sharing that as well. But that's why I say, don't ever feel, feel free to ever ask questions, because if you don't know, you won't have, you just don't know if you don't ask. So, and my mother always tells me that there's no silly question except the one that's never asked, right? So that's right. Always listen to your mom. So Lori, yes, we can certainly, talk to you more about that and how to use your passport for these services. So thank you so much. Well, with that, I will give you back your evening. I thank you. I thank you. I thank you. Thank you all to our members for being here tonight. Thank you to our panelists for a wonderful showing tonight. Thank you, Aaron and Sue, for putting on this speaker series, and we will look forward to more to come in the future. Thank you guys, and have a wonderful evening.